Measuring blood pressure is an art. Blood pressure should not be measured at the pharmacy. You shouldn't rush to the pharmacy to get your blood pressure measured, nor should you have it measured immediately after rushing to the emergency room and sitting down. Blood pressure means the pressure of blood in your body, and blood pressure is sensitive to many things. If you want to learn how to measure blood pressure properly and want your readings to be accurate, watch this video until the end and repeat your measurements. You will achieve much more accurate results. The first rule about blood pressure should not be measured while talking. If you are tense while measuring your blood pressure and you keep talking, know that your blood pressure will come out high. To measure blood pressure accurately, you need to remain silent for at least 5 minutes. We want to standardize blood pressure measurement. If there is not at least 5 minutes of silence, the blood pressure reading will be high. In fact, this is why office blood pressure measurements usually come out high. So the measurements taken when you visit the doctor are usually high. In other words, the blood pressure measured under hospital conditions may not be your true blood pressure. The blood pressure you measure at home is more important to us. Silence is especially important. The second important rule in measuring blood pressure, our hands and feet must be resting on something. So, while I'm sitting here, my feet should be comfortably resting on the ground. You shouldn't measure blood pressure with your legs crossed, when you're restless, when you're swinging your feet, or when your arm is in the air. Our arms should be relaxed and resting on something, and our feet should be on the ground. Or if we're measuring at a desk, our arms should be supported like this. Measurements taken while your arm is in the air will be inaccurate. Blood pressure should not be measured right after meals, alcohol consumption, or smoking. You should wait at least half an hour in between. Your blood pressure will read high after smoking. If you measure your blood pressure immediately after eating, it may come out high or low. In other words, the result will be inaccurate. To measure blood pressure properly, your stomach should not be too full. If you've overeaten or if you have stomach pain or gas problems, that blood pressure measurement will be inaccurate for us. That's why we say, don't measure your blood pressure when you're very hungry or very full, don't measure it immediately after meals, and don't measure it right after smoking. Because these factors seriously affect your blood pressure and prevent us from reaching the basal blood pressure values that we actually want to measure. Measuring blood pressure is an art. If you don't pay attention to these measurements, you might accidentally become dependent on medication. One of the golden rules of blood pressure measurement is to take the measurements at similar times. Let's say you're going to bring your blood pressure readings to your doctor. Your doctor will decide whether or not you have hypertension based on these readings. They asked you for a 1-week follow-up. If you measure your blood pressure at noon one day, in the morning another day, and in the evening another day, your doctor won't be able to determine whether you have hypertension or not. In our clinic, we usually do it like this. We ask for 3 measurements a day. One of them is the measurement taken by the patient while sitting right after waking up, before getting out of bed. The second is the measurement taken while sitting, right before going to bed at night. The third is the measurement taken during the day while at rest. These 3 measurements should be done in a standard way and at similar times. Blood pressure measurements taken at similar times and in similar ways are the main measurements for us. When measuring blood pressure, always use validated and calibrated devices. In our clinic, we use either digital or manual blood pressure monitors. But as you can see, a manual blood pressure monitor requires 2 tools. One is a stethoscope and the other is the manual blood pressure monitor itself. You cannot measure your own blood pressure with this device. Someone else must take the measurement for you. A manual blood pressure monitor is not absolutely necessary. We also trust digital blood pressure monitors. The devices of those who say, "Doctor, I think my device at home is probably wrong," usually turn out to be accurate. What matters here is that the device is calibrated. If it's a new device, it is most likely calibrated. However, if it's a blood pressure monitor that has been sitting in your home for many years, has lost its functionality, and has been left in a corner for a long time, then it may need calibration. You cannot calibrate it yourself. You should consult the place where you purchased the device about this. If the calibration is off, your blood pressure readings will be inaccurate. When measuring blood pressure, you need to use a cuff that matches the size of your arm. The cuff should wrap around your arm at least 1.5 times. Here, I see a manual blood pressure monitor. Look, I can attach my manual blood pressure monitor to my arm like this. I apologize for the noise. If this manual blood pressure monitor does not wrap around my arm 1.5 times, it may give me an incorrect reading. Where is this important? Usually the cuffs are suitable for you, but if you are overweight, if your arm circumference is very large, or if your arm is very thin, if the device wraps around your arm 2 or 2.5 times, or if it can barely make 1 full turn and you have to put it on tightly, then the readings may be inaccurate. Especially in digital blood pressure monitors, the sensor is inside these cuffs. Because the sensor is inside, if you tighten it too much, it may give an incorrect reading. If you are very overweight, you can opt for devices that measure from the wrist instead of the arm. Measuring blood pressure is actually not difficult. There are just some basic rules. If you also measure your blood pressure by paying attention to these rules, we can get a more accurate idea about you. Now, I'm coming to the most important rule. Blood pressure should not be measured when you are tense or very upset. You got angry at someone, or you generally have a tense personality. This could be what we call nervous hypertension. In that case, your blood pressure will come out high. If your blood pressure comes out high in such situations, please repeat the measurement. Usually 2 measurements are taken when measuring blood pressure. The lower measurement is more reliable. You can measure from both arms. You can continue measuring from the arm where the blood pressure is higher. But if the measurements in both arms are similar, you can continue from either arm. So the arm with the higher reading is the one we should prefer from now on. You should be calm while measuring your blood pressure. You should avoid talking to anyone around you for a while. You should be relaxed. Don't rush to the pharmacy and have your blood pressure measured in a hurry. Don't immediately strap on a blood pressure monitor when you've gotten angry with someone in a rush. In fact, I see this too. People become dependent on blood pressure monitors. They carry a blood pressure monitor in their bag, at home, and in their car. They measure their blood pressure 20 times a day. You shouldn't measure your blood pressure 20 times a day. If we say that measuring blood pressure is an art, then 3 measurements a day are enough. If I start measuring my blood pressure 10 or 15 times a day from now on, because of this anxiety, I would soon become a hypertension patient. Don't turn blood pressure into a source of anxiety. The values of your blood pressure at rest and under certain conditions are the correct values for us. There is no need to measure it 20 times a day. You need to break free from your blood pressure obsession. Moreover, you can seriously overcome hypertension through lifestyle changes. With the DASH protocol we implement in our clinic, we are achieving very good results regarding blood pressure. We change people's lifestyles and bring their blood pressure down to almost normal levels. In our clinic, we help people get off medications every week. When a person changes themselves, their blood pressure starts to improve, and we reach a point where we can discontinue their medications. If you have high blood pressure and are ready for a change, and you say, "Doctor, I want to manage my blood pressure better with lifestyle changes," then we are waiting for you. Lifestyle change is the most important treatment for high blood pressure. Don't forget to watch our other videos on blood pressure and heart diseases on our channel.